Hi, my friend. Welcome back to the Holistically Well podcast. Today's episode is an important one because we're talking about postpartum core and pelvic floor red flags that too many women are told to ignore, normalize, or quote, wait it out. I want to be very clear from the start. Postpartum recovery does not need to be perfect, but it should be supported. And while some symptoms can be expected as the body heals, there are others that are signals asking for attention, guidance, and care. This episode is not by any means meant to alarm you, but it is meant to empower you with discernment and with knowledge so that you know when to reach out for help and when reassurance is enough versus when you need to seek out care. And I want to quickly touch on the fact that in Europe, it is standard of care that every single woman postpartum is referred to pelvic floor physical therapy by her OBGYN or midwife. In the United States, it unfortunately is not even standard of care to refer women to pelvic floor physical therapy even after major abdominal surgery such as a cesarean section. It is rare for our clients to be referred to us from their provider, and most of our patients are finding us on their own. They are self-referring. And as a private practice, we are able to accept clients as doctors of physical therapy without a referral. So as you are listening today, if you are like, oh my goodness, I need help, I need support, please know that at least in the state of Ohio for our practice, you can reach out directly to us. You do not need that middleman of your provider to refer you. And I want you to know that no concern is too big or too small to reach out for support. Again, if we look at our European friends, they are referred no matter what to physical therapy. And why I love this so much in the postpartum season is that we can catch things so early on and you don't have to suffer. You can just have things addressed right away and be given knowledge and support and feel empowered to address these symptoms early on in your own body without having to go through the pain or the suffering first. So my blanket recommendation is for women to get pelvic floor PT, get that evaluation, see what's going on in your body, and then make that decision with your provider. Do I need to continue care, or is just that evaluation enough and I'm actually doing really well? And that is more the standard of care in Europe and how they approach it, so we can get these screenings across the board versus waiting until a woman has suffered for years before she reaches out for support on that last straw. So today we are covering what is normal versus what is not normal during postpartum recovery. And I really hope that this conversation leaves you feeling empowered and more in control of your own body so that you can self-refer if you feel like it's needed and you're not just feeling lost and unsure of what's normal or what's not in your own body. All right, so let's start by grounding ourselves in what can be normal in the weeks after birth. Your body has experienced immense change. Tissue stretch, hormonal shifts, nervous system adaptation, and pressure changes, both in our core and our pelvic floor. Some degree of sensation or awareness of these changes, and of course, fatigue, is absolutely expected early on. Your body is changing. So we can normalize things like mild soreness. Awareness through the pelvic floor of those healing tissues, maybe a stinging or a burning sensation when you're using the restroom. We're going to notice fatigue with activity. We are going to notice a general feeling of fatigue and being tired just due to lack of sleep as well. You'll notice rebuilding coordination, just that your muscles feel a little disconnected. And the big reason for that is the fact that they were very overstretched. And now there's a looseness to them, right? They had this internal pressure from the inside out, and now that's not there. And so those muscles have to figure out how to shorten again, how to activate again, and how to support you again. And so having mild soreness from things like breastfeeding and sleeping in different positions and holding your baby for long periods of time, alongside of this fatigue and this new awareness in your body, that is normal, but normal does not mean permanent, and normal does not mean something that you should simply push through or ignore. Even in these normal feelings of mild soreness, discomfort, fatigue, I personally have been very proactive in how I address them. I like to call these normal sensations warning signs. It's our body telling us that we need some support, and if we don't give the body support in this season with what is considered normal, then we can see the body progress to what is abnormal, which would be these pelvic floor red flags that you should not ignore, which we'll dive into next. So you should certainly go back and listen to my previous episode if you have not already. I'll grab it for you here. Episode 42, where I really dive into what postpartum recovery and support should look like in the first 4 weeks after childbirth. That episode gives you clear guidelines on what kind of activities you should be doing, how you should be nourishing your body, and that will help you move through these more normal symptoms that are on the mild end. But again, if we don't address it, they will escalate. And so it's very important that you address it. I also want to mention that you can never replace going in for one-on-one physical therapy support. So getting that evaluation with us, we can do so virtually or in person. We're located in Sydney, Ohio. We also do virtual consults worldwide for that ease of care. We know that it can be hard to get out of house those first 4 weeks postpartum, but that doesn't mean you can't support your body and begin steps towards healing. So visit drkaylaborchers.com. You will see our one-on-one treatment options as well as our online programming that you can just move through self-paced to, again, start supporting these normal, mild symptoms that we do want to support and address early on. Now, what are pelvic floor red flags that you should not ignore and that you should reach out for support right away? So we're going to talk about symptoms that deserve a closer look because these are often minimized or brushed off, even though they're your body communicating very clearly that something is not quite right. Red flags, to explain gently and clinically at this point, would be persistent leaking, urine or stool, especially beyond these early weeks. So you may notice leakage of urine and inability to control holding it in when you are walking or if you're lifting your kiddo. Now, in weeks 0 to 4, when we're refiguring out that coordination, and again, those tissues were overstretched, now we're figuring out how to activate them without that internal pressure. That may happen and it could be normal as long as it stops. But if that continues beyond the 4 weeks, I absolutely would reach out for pelvic floor PT because oftentimes it only worsens or persists versus we can start addressing it early on and it's much easier to heal those symptoms the earlier we address it. So persistent leaking of your bladder or your bowels, so poop or pee, beyond 4 weeks postpartum, I would reach out for support. If you are feeling heaviness or pressure or a falling out sensation in your pelvic floor, this would be a sign of prolapse. And prolapse is when those internal organs start to prolapse through or move through a weak spot in the pelvic floor. And again, the symptoms for that would be a feeling of heaviness, a feeling of pressure, like baby's head is right there, but I know I already gave birth, so that's clearly not what's happening. Or this falling out sensation, like something is falling through my pelvic floor. That would be a sign of prolapse, and you definitely want to reach out for a pelvic floor PT evaluation. Pain with intimacy that doesn't improve. So beyond that 6 weeks postpartum, whenever you get the clearance from your OBGYN or your midwife to return to intercourse, if you are having pain with intimacy that does not improve with subsequent bouts, again, reach out to pelvic floor PT. That is not normal. Don't let people tell you that it's normal to have pain with intimacy postpartum. It's not. Now, is it going to feel different the first time? Yes, it can feel different, and you have to be more gentle as you go back into something for the first time. But if it doesn't improve each time, again, reach out for support. To note with that as well, it's very normal to be more dry postpartum because of that huge drop in estrogen. And so you may use things like lubrication to assist with that. And that is very normal. So just giving yourself lubrication to assist intimacy, if that solves the problem, then perfect. You're good. That is normal. But pain beyond that is abnormal. Please reach out for support. Now, if you have a difficulty relaxing or fully emptying your bladder or bowels, so something I'll hear clinically often is women are like, I use the restroom and then I stand up and a little bit more leaks out, or I stand up, I go to get water, and then I feel like I have to go to the bathroom again. I go and sit on the toilet and I have to go to the bathroom again, even though I didn't even drink that water. So that is a sign that your body is not fully emptying your bladder. Same thing for bowel. If you feel like you have a bowel movement and then you stand up and you notice a little bit more comes out when you stand or once you're going about your activities, the few minutes that follow, or within a half hour, you feel like you need to have a bowel movement again. Those are signs that we're not fully emptying and not able to fully relax the pelvic floor muscles to allow for full emptying. Again, I would reach out for an evaluation so that we can find out specific to you how to control that nervous system, how to re-regulate those muscles so that they can fully relax and allow a full bladder and bowel emptying. And then the final red flag that we want to cover today is pain that increases with movement or exercise. So let's say you're starting to feel better, you're beyond that first month postpartum and you're ready to start going on 10 to 20 minute walks each day. And you notice that as you do so, you have hip pain, or you have low back pain, or you have SI joint pain in the back of that pelvis, or tailbone pain. That's another one I commonly hear. That is not normal, okay? Reach out again for an evaluation and support. So these symptoms are not a sign of failure. It's not a sign that your body is broken, but they are information. It's your body communicating with you and that it would benefit from early intervention. Again, the earlier we intervene and we don't let these things just ride out, the easier it is to resolve and heal. Now, pelvic floor dysfunction can present as weakness or excessive tension. Ignoring these symptoms often prolongs recovery. And this is an important note to clarify because so often women think, okay, I just need to do Kegels because my pelvic floor is weak because it just expanded a ton to give childbirth. And that's not often the case. Oftentimes we actually see excessive tension in not only the pelvic floor muscles, but the muscles surrounding it. So we see this in the hip muscles, the buttocks muscles, and even gripping of some of the core muscles. And so just doing Kegels or just going back to core strengthening can actually make symptoms worse sometimes and prolong recovery even further. And this is why individualized care can be very, very helpful for women postpartum, and why I'm a huge advocate for the United States following our European friends in getting every single woman a postpartum physical therapy evaluation, as that should be standard of care. All right, core red flags beyond just, do I have a diastasis recti? All right. So when most women think about postpartum core recovery, they immediately think of diastasis recti. But the core is far more than just the space between our front six-pack abs, where we see that diastasis recti, or that separation of those six-pack muscles, and a coning and doming along the midwife as a woman returns to activity postpartum. Now, the real question is, how is your core functioning as a pressure system? So yes, this can show up as diastasis recti, but it can also show up in other areas. Core red flags to consider would be doming or coning with basic movement. So this would be that sign of your diastasis recti needing some support. Another core red flag would be persistent low back pain or pelvic pain. So when the core canister is not providing support to the areas around it, this can show up as low back pain or pelvic pain. We could even see hip pain as a result of this. An inability to tolerate light loading. So my mind draws to wearing your baby or carrying your baby, right? If you are experiencing pain with doing so, that's a sign that your core is not on board and that we need to address that. If you are noticing yourself holding your breath or bearing down during movement, so you have to hold your breath in order to lift baby's car seat up into the car, or you're bearing down whenever you do that movement. Again, a core red flag that we need to address. And finally, feeling disconnected from the abdomen. So if you're like, I am doing these free YouTube videos, I am trying to reconnect to my core muscles and I just can't, there's just a disconnect there, reach out for help. That is something we oftentimes see, particularly in C-section mamas, because you had a huge incision made through 8 layers of tissue, including your core muscles and sometimes nerves. And there can be this disconnect from brain to muscle activation that we need to address. Now, the core works with your diaphragm, which lives at the base of your rib cage, and your pelvic floor, which is on the bottom. And we think of the diaphragm, the pelvic floor, and the core, which wraps around from the front to the back as a canister. Dysfunction in that canister can show up during movement transitions, lifting, or when we're fatigued. And those muscles need to work in unison for optimal function, especially as we return back to daily activities. And so you need to watch for this in your own body, particularly as you start feeling better and returning to activities of daily living beyond just caring for your newborn. Because if you start to see these core red flags show up, please, hit that light bulb moment and reach out for support. These symptoms are often missed or dismissed because women are often told that this is just part of motherhood. It's not. It's not. From a physiological standpoint, persistent symptoms are not something we're meant to tolerate indefinitely. And this is why I am so passionate about this as a clinician and a mother of 4. Before I even had children, I worked in sports medicine, and I saw so many women who were within that first year postpartum or even a decade postpartum. And as they got back into CrossFit or Pilates or running half marathons, they had more intense symptoms beyond what we're talking about today. And for each one of those women, I just wanted to hold them by the shoulders and tell them, I wish I could have been there for you earlier on. I wish I could have caught these symptoms before they turned into what they are now, before they led to surgery or significant prolapse. That was much, much harder to repair than if we caught it on the front end, okay? I also think there's a huge systemic context here in terms of limited postpartum follow-up, particularly in the United States, and having symptom-based clearance versus functional assessment. So at that 6-week postpartum checkup, that is the only thing most women get here in the US for postpartum care. Oftentimes they're not even given an internal assessment of the pelvic floor or any kind of strength assessment at all. The woman is just asked, are you having these symptoms? How are you feeling? Okay, check mark, you're good to go. Versus in physical therapy, we are going to measure the strength of each of the muscles surrounding your pelvis. We're going to specifically look at your core and how it is healing. We'll measure a diastasis. We can look internally at the pelvic floor or externally and see how those muscles are firing. We're looking at how you're moving, how you're squatting, how you're lunging. It's so much more thorough, and that is really what women deserve. And then finally, I think a lack of education around pelvic health definitely contributes to why these symptoms are often missed or dismissed in the healing of postpartum women. Now, organizations like ACOG, the American College of Obstetricians and Gynecologists, acknowledges the importance of postpartum recovery, but many women still fall through the cracks when it comes to functional care, and it's certainly just not translated to practice at this point, where most women aren't referred automatically when they should be. So knowing when to seek support is just as important as knowing what you're experiencing. If your symptoms are persistent, worsening, or limiting your daily life, it's time for help. It's time for extra guidance. Now, again, your support should include assessment of your breath, your pelvic floor, your core, and how it all works in unison together. A movement-based evaluation, not just you lying on the table, but how are you actually moving with your baby? How are you walking? How are you transferring? Those things can all be included in a pelvic floor PT assessment. And then education of what you can actually apply at home. This is my favorite and what really sets physical therapists apart from other providers, such as a chiropractor who can also be very helpful in your care. But as physical therapists, we actually give you home exercises that you can do in the comfort of your own home to help yourself on a daily basis versus only being reliant on us for relief of your symptoms. All right, my friend, I want to assure you that early intervention is not being dramatic or being bougie. It is preventative, wise, and leads to better outcomes long-term, and actually less investment in your care because the course of care is much faster the earlier on that we address it in pelvic floor physical therapy versus just the wait and see approach. Postpartum recovery is not about being hypervigilant or anxious about every sensation that you feel. It's about learning how to listen to your body with wisdom and compassion so that you can address red flags on the early end versus waiting and seeing and suffering when you don't need to. Red flags aren't something to fear. They're invitations to care for yourself far more deeply and lead to better healing outcomes for you as a mother now so that you can more optimally show up not just for your baby, but for your spouse and for your other children if you have them. All right, my friend, thank you for tuning in to the Holistically Well podcast. If today's episode spoke to you, would you do me a favor? Take a moment and leave a review. It truly helps us guide future episodes and how we can support you as you learn to move, heal, and optimize your health outcomes across the women health lifespan.